And then after you have your experience, a lot of times you're like, what the F was that? I don't know if I can swear on the podcast.
You can say whatever you want.
Like, what the fuck was that? You know, what just happened? Like that was mind blowing. You know, what did I just go through?
Health, fitness, mindset, nutrition. Live better and longer. I'm Saad Alam, and let's hone in.
What is a microdose?
So it's an interesting debate because some people would what a microdose should truly be a sub-perceptual dose. So a dose you take where you don't feel any psychoactive effects, whatever. What's tough is when people claim to have therapeutic benefit from microdosing, you know, you get into this world of, okay, where are they feeling a low dose? Are they feeling something that's mood elevating or not? So there's a bit of kind of chicken and egg or a circular problem to that. But technically it should be a dose level in which it's sub-perceptual. You're not feeling any effects from the psychedelic, but there could be other health benefits. We hit on inflammation at low doses. I mean, some people anecdotally do claim to get a lot of benefit. At the same time, there's been research to suggest, you know, in controlled studies, it may not carry that much benefit. There may be a lot of placebo involved. Subjectively, there's visual effects, of course. I wouldn't describe it as hallucinogenic. You know, you're not seeing anything. And even with traditional psychedelics, rarely do people really see things that aren't there. Things can take on a wavy quality, stuff like that. But internally, the brain goes into sort of a more entropic state. Like you're able to evaluate pathways you normally wouldn't. It helps people kind of shut in. With a lot of these, we see a shutting off of what's called the default mode network. So again, the brain really lights up. A lot of regions that don't normally communicate begin to communicate with each other. And for a lot of people, I think the best way to describe it is it's like psychotherapy on steroids. It's like taking hours, you know, what would be months of psychotherapy and condensing it to a few hours. Now, I'm kind of generalizing between ketamine and traditional psychedelics, but, you know, different people respond differently to different drugs. So there's a lot of heterogeneity, but some people prefer ketamine, others traditional psychedelics.
And so is it fair to say that what traditional therapy forces you to do is connect different parts of your brain or make associations between events that you normally would have, and that psychedelics actually just accelerates that process, or are they two separate things?
I think some people would certainly say that. I mean, if you think of therapy as kind of getting more to the roots of what's really, you know, driving some qualm or driving a mental health disorder, you know, an ability to really cut through a lot of the brush and really get to the heart of a matter, I think psychedelics do help that. And part of that shutting down of the default mode network, a bit of kind of, you know, toning the mind down to not block out what you're normally blocking out, I think certainly helps.
Speak to me a little bit about when people take psilocybin, specifically in therapeutic sessions. What does that experience look like, and what is the therapist doing to help them actually deal with that trauma and pain? Yeah,
you know, it is interesting. I think a lot of traditional psychedelics are great with dealing with loss, without a doubt. But so prior to a psilocybin session, there's usually some very rigorous, what we call pre-integration. So talking with the therapist, kind of making an assessment, you know, of what's kind of driving someone's depression or mental health disorder. What are kind of the key qualms to it? What are some of the psychotherapeutic roots of that? So, you know, it provides a bit of a blueprint and a map prior to the experience. And then going into the experience, you know, in a perfect world, the therapist doesn't have to do much and the patient doesn't need a lot of hand-holding, and they kind of go to where they need to go. But usually the therapist is there. They can be a bit of a guide. So, you know, eventually, you know, being able to calmly bring up a topic that was brought up prior that they may want to evaluate. But more typically, you kind of let the patient be on their own. They put an eye mask over, which is really helpful. You're playing calming music as well, which is conducive to a psychedelic state. And I think the biggest thing, you know, what they usually say is when you have a fearful experience in a psychedelic journey, don't run away from it. Kind of don't run away from the monster. Yeah, go into it. Exactly. And so oftentimes if a patient is struggling or some fear starts bubbling up, it's really nice to have a therapist there who is able to handle that, kind of calm them down, and also encourage them to go deeper and evaluate that, which is usually where you get really deep therapeutic benefit. So I'd say that's the primary role. You know, you could have adverse events. People could get very scared. Therapists are trained. on how to manage that and navigate that. But that's more for adverse events. Most patients, are totally fine. It really is psychotherapy. So you have the pre-integration, and then after you have your experience, a lot of times you're like, what the F was that? What just happened? Like that was mind blowing. What did I just go through? And so afterwards, making sense of that, really solidifying some of the key lessons as well, kind of codifying those, making those more concrete, is where post-integration plays a really big role. So the therapist is there as well. And, the therapist can take notes and usually bring up things that came up in your session that you may have even forgotten. So it's really integrating, everything that happened, kind of the key lessons, the key insights that hopefully you can carry with you for a long period of time.
Is there one that you specifically speak very highly of?
There is. Actually, there's a few, especially around the ketamine space, since ketamine currently can be prescribed off-label, so a lot of people are for depression. There's a variety of companies. There's, so the one company we're invested in that we think is the safest bet is called Journey Clinical.
Yep.
So what they do is they connect patients with psychotherapists, or there may already be a relationship there, but usually the psychotherapist doesn't have access to a compound pharmacy to get their patient ketamine, and then also get trained up to offer ketamine-assisted psychotherapy. So there's a lot more oversight involved in that, whereas there are some other models, I don't want to name names or pick on people, but other models where they just kind of send you ketamine and you go on your merry way, which I think is very dangerous.
Hold on, no therapeutic session, just here's ketamine?
Sometimes no. So there's one company where, there's a trip sitter involved. You sort of find a designated trip sitter, but that could be your roommate or your neighbor down the hallway, which if someone's not experienced in what that looks like, the odds of them freaking out and calling the cops or something are pretty high. Like that doesn't seem safe. And I've heard some crazy stories too of people like crushing up their lozenge and snorting it. And things like that. Like there's no oversight. It's kind of the Wild West there. So our bet is there's going to be a big regulatory crackdown in just the risk of patient harm, even if it's still low. You want very, very tight controls. So Journey Clinical is the bet we've made, and we think that's the safest. I do think a trained therapist, a trained guide should be involved in the process with something. This isn't cannabis. These are strong drugs. So the regimen it's what's called the Fadiman protocol. So it's 1 day on, you microdose a certain day, and then 2 to 3 days off, and then re-up. Do that same dose. And you do that for a pretty prolonged period of time. People will do that.
1 day on, 2 to 3 off.
Yeah, so no microdose, because you develop tolerance very quickly. And I think a good thing for the audience to know as well, you develop cross tolerance too. So I've seen some people thinking they can get creative of like, I'll do psilocybin 1 day, I'll do LSD the next, and then mescaline the third. So I don't develop tolerance. It doesn't work that way, sadly. You can't cheat the system on that. They all hit the same receptor. They kind of blast it, and you do develop tolerance. But so people will do it 1 day on, 2 to 3 days off, and do that for quite a period of time, usually 6 to 12 months. They do recommend eventually halting for some period of time, more out of abundance of caution. I hit on potential long-term cardiac effects that we just don't know. What I outlined is loosely the Fadiman protocol, that 1 day on, 2 to 3 days off. So that's sort of the gold standard of what people do and attest to with microdosing. That's balancing a therapeutic effect with safety as well. So kind of minimizing adverse events, off-target effects.